Hello, nurses all over the world. I want to welcome you back to my YouTube channel today. How are you doing? And I want to really appreciate you for always coming back to my channel. Yeah, and I want to ask, have you been able to learn one or two things from my content as a nursing student and as a practicing nurse? Okay, so today our topic is hyperthyroidism. That's what we'll be dealing with today. So let's go straight into the topic. The first thing I want you to know is the definition of hyperthyroidism. Firstly, hyperthyroidism is also known as overactive thyroid or hyperthyroidosis. So those are the two other names you can give to hyperthyroidism, and is a condition that occurs due to excessive production of thyroid hormones by the thyroid gland. I hope you know where your thyroid is located. It's located right in front of your neck. So that's where the thyroid gland is located. So if the thyroid hormone is being overly produced, is excessively produced, then it causes hyperthyroidism. Yeah, so what are the causes of hyperthyroidism? The first one is grave disease, so it can cause it. Excessive intake of iodine through diet, dietary supplement or medication can also cause hyperthyroidism. Tumor or infection of the thyroid gland can also cause hyperthyroidism. Another one is certain tumor of the ovaries, testes, or pituitary gland can also cause this hyperthyroidism. And what are the risk factors that are associated with this hyperthyroidism? The first one is gender. Women are more prone to develop hyperthyroidism than men. And family history can also cause it. Another one is chronic disease, such as type 1 diabetes, pernicious anemia, and primary adrenal insufficiency. So all those points are risk factors that are associated with hyperthyroidism. So the next one is symptoms of hyperthyroidism. The first one is swollen thyroid gland, prominent eye, you see the bulging of the eye, increased metabolic rates, irregular or rapid heartbeat can also be part of the signs and symptoms of hyperthyroidism. Increased blood pressure, also shaking hands and increased sweating. There's profuse sweating. Hot flushes is also part of the signs and symptoms. Another one is irritability and restlessness. You will see that the patient is restless. Increased bowel movements. Weight loss is also part of the signs and symptoms of hyperthyroidism. Another point is weakness, fatigue, malaise. There are also signs and symptoms. Difficulty in sleeping, brittle ear. You see the ear, they're falling off. Ear loss is also part of the signs and symptoms of hyperthyroidism. Then nausea or vomiting. Then irregular menstrual cycle or amenorrhea in women. Then the last signs and symptoms is breast development in men. This is also a sign of hyperthyroidism. So how can hyperthyroidism be prevented? The first one is take only prescribed nutritional supplements. You don't do self-medication when it comes to supplement intake. Another one is exercise regularly so that you can keep fit and get rid of unwanted elements in your body. And another one is learn relaxation techniques such as yoga, deep breathing exercise. You can also do that. Then avoid smoking and intake of alcohol. Those are the things. And healthy living is also part of it. You eat healthy. You make sure that you prevent as much as possible junks so that you know the quantity of iodine, calcium, sodium, for example, that you are putting in your diet. And when you go for your grocery shopping, you also read the leaflet, read the back of any product you are buying. I'm just going to encourage you to do that because you will see the percentage of each element you are buying. For example, sodium, calcium, iodine, you will see and you will know how to keep it in check when you are doing your grocery shopping. I hope that is going to help somebody. And the next thing is complication of hyperthyroidism. The first one is thyroid storm, which is just the worsening of the symptoms of hyperthyroidism. If untreated for a long period of time, it can result to thyroid storm, loss of consciousness, shortness of breath, very fast or highly irregular heartbeat, atrial fibrillation, osteoporosis, and eye problem. There can be eye involvement when it comes to the complication of hyperthyroidism. Then let's talk about the diagnosis of hyperthyroidism. The first one is medical history, which is the first thing you do for your patient. You take history, then you do the physical examination. And blood tests can also be done to check for high level of thyroid hormone. It can be done. Imaging can also be done to examine the thyroid. And a low TSH, thyroid stimulating hormone, and high free T4 and T3 blood test can also indicate hyperthyroidism. Then another one is the treatment of hyperthyroidism. Anti-thyroid drugs can be used. And the first one is metabolism. It's just to stop the hormone production. You want to stop the excessive production of the thyroid hormone. And beta blockers can also be used. Example is propranolol. So you can also use that one to control the rapid heartbeat or the irregular heartbeat, sweating, and pulse. You want to keep those ones in check. So another one under treatment is radioactive iodine. And how is this carried out? It's just a treatment that uses radioactive iodine to destroy cells inside the thyroid gland to reduce its activity. The overall goal is just to reduce the overproduction of the thyroid hormone. And the last one under the treatment is surgery. This involves removing the thyroid gland or the nodules there, the thyroid nodules, which may require lifelong hormone replacement therapy. Once this surgery is carried out, then you can be sure that the patient is going to be on hormone replacement therapy for the rest of his or her life. So let's talk about the nursing intervention. Yes, that's our role in the care of patients with hyperthyroidism. So the first one is assessment. How do you do your assessment? You do your vital signs, you monitor for tachycardia, hypertension, and irregular heart rhythm. So you want to do that. Then you keep track on the weight of the patient. You ask for the bowel habit too. You monitor for diarrhea. When there's increased bowel movement, it's also a sign of hyperthyroidism. Then you check for the mental status of the client. You check for the mental status of the client. You assess for anxiety, irritability, or insomnia. Another one is you do eye assessment. You want to assess the patient for exophthalmos, that's the bulging of the eye, and periorbital edema. Then another point is medication administration. I've talked about methimazole. Another one, propranolol, which is an example of beta blockers. So you ensure that your patient takes the prescribed medication. Then you want to give nutritional support. You ensure that the patient is taking healthy diets. You increase caloric intake of the patient. You advise patients to consume a diet rich in calories and nutrients to maintain their weight. And when it comes to their nutrition, you encourage them to avoid stimuli. That is, you recommend avoiding caffeine and other stimuli that can exacerbate the symptoms. Another one is environmental modification. So you encourage the patient to stay in a cool environment. You suggest that they wear a lightweight clothing and avoid hot weather. You know, I talked about it earlier that profuse sweating is part of the symptoms of hyperthyroidism. So you encourage the patient to always stay in a cool environment, and they should not wear a thick clothes. They should also avoid hot weather. Then eye care. If the patient is having exophthalmos, then you recommend lubricating eye drops and shielding the eyes from bright lights. You also want to monitor for thyroid storm. Thyroid storm is just the worsening of the symptoms. So you watch out for thyroid storm because it's a very major complication of hyperthyroidism. You educate the patients about the signs of thyroid storm, which include fever, tachycardia, vomiting, diarrhea, and altered mental status. So those are the examples of thyroid storm. So you watch out for those things. Then immediate intervention. Emphasize the importance of seeking immediate medical intervention if thyroid storm is suspected. I said it earlier. So you need to tell your patient the signs of thyroid storm. And if they see one or two signs of the thyroid storm, they should not hesitate to seek immediate medical intervention. Then another one is education on treatments. So you educate your patients on the treatment therapy, on the treatment regimen, which is radioactive ion therapy. I said it earlier. Another one is thyroidectomy, which I talked about the earlier when I was talking about surgery. So the removal of the thyroid gland is thyroidectomy. So you tell the patient, you discuss the surgical removal of the thyroid gland and the need for a lifelong hormone replacement therapy with the patient. That is very, very important. So you tell the patient that after the thyroidectomy, the patient has to be on a lifelong hormone replacement therapy. And you also give psychotherapy. You encourage the patient because it's a lot for them. You can imagine a patient that's going in for thyroidectomy and they have to be on a lifelong medication. So you give emotional support, you encourage the patient, you do diversional therapy, you just watch out for the patient. Also introduce them to a support group. Yeah, that's very important. So a support group is just where people that are going through the same disease condition, where they meet, they discuss their challenges, their improvements, and people get to ask questions from them. So you can also introduce the patient to a support group. Okay, so that's all about hyperthyroidism for now. And that is where we are going to be drawing the curtain for today. I hope you have been able to learn one or two things about hyperthyroidism. My name still remains Nurse Felicia. And until the next time, bye.